Great. So we're going to start, right? All right. So here's the agenda what we're going to talk about today. We're going to debunk some myths about med school because I know you guys, especially people who've been dreaming of med school, have been hearing about med school for the past many, many years and heard all these horror stories and things of med school, right? So we're going to debunk some myths. Then we're going to go into what to actually expect in med school, what it really is like. Then we're going to talk about the priorities that you should be in medical school. So especially the first years and even the second years, it's good that throughout the whole 5 years you have some priorities. Because what tends to happen is that people kind of get lost in the process of it all. And it's good to just focus on what you need to know what's important, right? And then we're going to, especially for the first years and also the second years, we're going to talk about how to approach the first year and pre-clin years. And then we're going to talk about some study tips. Brandon also asked me to mention a little bit about USMLE because I know some of you guys might be curious about it. So we'll talk a little bit about that, but that won't be the priority of the talk today. And then we're going to talk a little bit about the medical profession itself, as in the career of being a doctor, right? Because it's important to know from the first day of med school what you're really getting yourself into. So that's a plan for today. So firstly, we're going to talk about some myths that you might have heard about in med school, right? So the first one is that, well, this is not even everyone, this is every career choice, but high grades equal a better doctor, right? So I know that when you hear about med school or any school, people are always, aiming for high grades, right? But I can guarantee, especially being in med school and then also working as a doctor, because I've been working as a doctor for around 3 years now, high grades really don't mean much, right? It is good to get high grades. So I never tell someone to not aim for high grades, right? But don't think that having high grades will translate being a good doctor, right? Medicine is more of an art than a science, right? So being able to have the knowledge but not being able to apply it makes a world of a difference, right? So it's still good to have high grades, but don't be discouraged if your grades aren't high because that doesn't mean anything much to be how you could be a doctor in the future. So next thing is that I can't have a social life while in med school and I'll take a break when I'm dead, right? So especially when I remember when in first year, that's a thing that everyone talks about. As soon as they enter med school, they're just afraid that they won't be able to do anything. They can't take any breaks. They're just all school, 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 study, 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 right? And in my 5 years of medical school, I came to realize, well, after the first semester when you're all freaking out, right? But after you realize it is still possible to have a social life in med school and it is still possible to take breaks. And I've actually found and I've seen, and you can even ask others as well, that the people who actually tend to do better in med school actually have a social life and do other things as well, right? So I personally think it's always best to still keep some things on the side that are important to you, right? It helps with the assimilation of knowledge as well. Studying all the time is not helpful, right? And also you do have enough time to have a social life and focus on other things, right? But just need to know yourself and know when it's going to be too much, right? So it's best to always have a balance so you're not doing too much study and too much social life, right? And in med school is a bit more difficult than other career options where, yeah, it's going to be a little bit less time that you're going to have in med school, but still it's possible to have a social life. I personally had a friend. He's one of the smartest people who was in my year, right? And he doesn't study on weekends. He refuses to study on weekends. He loves football, so he says football is for the weekends, right? That's his life, right? I personally couldn't have done that, but still, other people I know, some people even had side businesses. People had families. People were even doing other certifications. People doing all sorts of stuff in med school. So it is possible, and people do survive. But you just need to know yourself to know if it's too much or too little for you, right? So next thing, there's no such thing as sleep in medical school. So this is something I'm very, very, very passionate when I talk about because especially when you start, well, it's a little bit better now that you guys are at home doing classes, but when you start going to med school when it's face to face again, you're gonna see your friends doing all-nighters every day. Some people staying up all night at the library, studying all these terrible, terrible, terrible hours, right? And I am proof that does not help, right? Sleep is very, very, very necessary. I know that when I started med school in first year, they actually had a psychologist to come speak to us and emphasize the whole benefit of having sleep, right? You actually can't assimilate knowledge unless you have sleep, right? Um, that being said, you shouldn't have too much sleep, but still it's important to have sleep. Personally in med school, especially in preclinical years, because when you get to clinical years, it's a bit more difficult. But especially in preclinical years, I refused to study past 10 o'clock and I was in bed at 11 o'clock every night, right? And that was just me because I love my sleep. I think sleep is beautiful, right? So you can't sleep in med school, right? I think especially when talking about the whole social life and sleep, it's always good to have a balance of everything, right? And when we're going to talk furthermore about being organized, when you're organized and you have a balance, you can really do a lot with your time, right? And you realize how much time you actually have, right? And especially this is just not only for medical school but even as a doctor as well. Well, some of you guys might have heard, but it's a common thing that doctors are overworked. And especially when you're at working as a doctor, you might not be sleeping for like 2 days, right? I've gone and not slept for 3 days straight when I was working, right? And things do happen, especially with accidents on the road, especially for you guys driving as well. In the year below me, there was actually a group of 2 students who actually they were doing an all-nighter for a week of exams and actually crashed in early in the morning and died as well, right? So that's why it's also important. Never at the end of the day, sleep is necessary. It's the most important resource you have, right? So don't play around with it, right? And always be safe, right? Next one is there's limited A's, right? Okay, so this was, especially for me, was a shocker coming into med school where I came from a very small school where we weren't necessarily competitive. But in med school, you're going to see that everyone is competitive. It's a very competitive environment. People don't like to hide things. People don't like to help each other. And that's like what Brandon was mentioning earlier. One of the things that I decided that I want to always help other people in the whole process as well, right? So just know that there's no limited A's, right? All of you guys can succeed, right? And it doesn't hurt you to help other people succeed, right? So just remember that going forward, right? That even with your resources, if you hear anything that's helpful, share it with others, right? And even if you're doing that, keep in mind there's going to be some people out there who are going to be selfish and not want to share stuff with you or like hide things from you. I've seen friendships be broken. I've seen lots of terrible things happening in med school because people are very competitive, right? And they don't want to help each other out, right? So just remember, there's no limited A's. I can guarantee you, even like even in certain rotations, barely people get A's anyway, right? So it helps that everyone gets A's, right? Next thing, yeah, so more medical myths. I need to go to every class, read every book, watch every video, and do every question. So when you guys have started, I think you guys have already started, right? But you might have heard now that there is legit thousands and thousands and thousands of resources out there, right? And it's very overwhelming. Like I remember when I started, they said, okay, you need to have a 1 gig hard drive to store all of your resources, right? And when you keep on hearing about resources every single day, up to the night before exam, you could hear about a new textbook that you never read, or you could hear about a different video you should have watched, right? And you do not need to read all of them. You do not need to have all these resources. What you do need to have is resources that work for you, right? And especially that's why it's good that you guys have Brandon and Umed and other, people like me and other resources, people out there to kind of help you with the resources and know what's helpful or not, right? But just know that you don't need to do everything, right? You don't need to read every single thing, right? You don't need to do all these things and all these extra classes as well. I know you guys might have started hearing about it, but it's a tradition in medical school where there's always these secret classes per se, where it's like there's a whole heap of these little classes going on that they hide from people, and people feel like you can't succeed unless you go to these special classes, and you do not need to go to them, right? In med school, I, as a matter of choice, I decided not go to any special classes because I kind of thought they're unfair that people are getting extra help than others. So, and I still did pretty well, right? So you don't feel worried that, okay, you're not invited to these classes, okay, that you're not gonna do well. Like I remember there's this one class that they said, okay, the only way you can get an A is if you go to this special class, and I didn't go to the class, and I'm the only one who got A for those courses throughout my med school. So just remember, don't feel overwhelmed that you might be missing out, right? It's still good to keep an ear open in case that, because sometimes it's important, right? What you might, yeah, but you don't need to do everything, right? Next, I have to do what others did in order to do well. So that's the next issue, right? Because when you go into med school, just like what we're doing now, where you'll be talking to people in the years above or other students or other classmates that you feel like you need to follow what others do, right? Every single person is different, right? Even what I'm saying now, I should have mentioned at the start that even what I say, they're just kind of my opinion. I kind of when I give people advice, I try to put it in a very open aired way so that I pretty much make sure that you guys realize that there's other options and you can do what works best for you, right? That's the most important thing that I think is important, especially at this so early in your medical career, that everyone is different and you need to find what works best for you, right? So don't feel pressure that you have to follow others as well. Same thing with the all-nighters. I remember in first year, I saw a group of students and they're doing all-nighters every day, right? And instead of like, they never came to classes, right? So they'll sleep during class time, but then they'll do all night in library, right? And that worked well for them. I told you about my friend who didn't study in the weekends. That worked well for him. I know some people who can only work with videos, study with videos. I know some people need textbooks, right? So just know that even if people are giving you advice, right, you don't need to do what they did to succeed, right? Even with what I did, I try not to give people exactly details of exactly what I did, because I don't really want people to emulate exactly what I did, because even if you follow what exactly I did, that may not mean that it may result more for you, right? And you might even find things that work better for you and do even better than me, right? I actually hope that everyone will, my goal is that people who will actually end up doing better than me. That's what my goal is, right? So always find what works best for you and just take everything what you hear with a grain of salt. So last one is very simple. I'll be saving lives every day. So just for you guys, especially, well, I know I was a Grey's Anatomy addict as well. Yeah, med school is not like they put it on TV. You will not be saving lives every day, right? And personally, and I actually think this is just a wise thing to do, avoid being in situations as a student where you have to save a life, right? Avoid it, right? Especially with you guys in first year, what? Like, I know people are going to be, your friends are going to be coming to you. Everyone is going to come to you. Oh, you're in medical school. Oh, you should know this. Don't, not now. Okay. It's not best to do it now. Even when you guys reach the clinical wards, right? And you guys are going to be seeing patients dying in front of you and everything. Don't play a hero, right? And avoid it. And also, no one's going to expect you to be doing that at all, right? So you won't have any cool stories to go home and tell your friends, oh, well, today in medical school, I saved someone's life. I cut off someone's leg or anything like that. It's not going to happen. It's not going to be like that, right? So yeah. And even in first, I know I was shocked, but the first 2 years of medical school, you actually don't see any patients, right? So I know I never even knew that when I entered medical school, right? So just remember that, right? So moving on, what to expect in medical school. So these are the things that, you actually see, right? So medical school isn't like other degrees, right? This was also a shocker for me. I know, like, so one of the things that you guys need to get out of your vocabulary, because it's kind of painful, especially for you guys who have friends who are doing other degrees or going abroad. So we do not have holidays. Well, pretty much we don't have much holidays. We have no such thing as summer. You guys get one summer between first year and second year. That's it. For fourth year and fifth year, I know you guys are in first year, so I don't want to worry you guys. And I think they should have told you this already, but in fourth year and fifth year, you're at school 50 weeks out of the 52 weeks of the year. So you only get a 2 weeks break during Christmas, right? And that's kind of, it's overwhelming to hear. And I remember when I first heard it, I was like, okay, I can't do this. But it sounds weird, but actually you'll get used to it, right? You will actually get used to it, right? But just know that it's not like other degrees. Your whole schedule, your examination process, how you guys study, how you guys learn is very, very different. When you guys reach clinical years, like, part of the way that you guys actually learn is, practical knowledge, right? Unlike other degrees where you only really get practical knowledge when you graduate, right? So it's very, very different, right? So that's one of the things that's important to realize, that, don't have these ideas that you have about college, what college is supposed to be like. Just, yeah, with med school is different. Med school, college, med school and other colleges, totally different situation, right? So next, there's a lot of clinical and social experience, right? So like I said, in first 2 years, even though like you're not on the ward, you still have to do lots of random stuff, right? You'll be shocked. I won't go into detail now, but you'll be shocked with the type of things that you'll get to do in med school, right? From clinical experience or even social experience. In fourth year, you actually have to go to the dump as well. You have to go and see elderly homes. You have to go do random things. You have to go and be a health inspector for a day. You have to go in fourth year, you even get to go on a cruise ship and inspect food, right? Right? You even get to go to hotels. It's really random stuff, right? It's very, very varied. And that's one good things about medical school, that you actually get lots of, not only medical knowledge, but you get lots of knowledge about everything, right? So that's one good thing for you guys who, like, just study medicine, right? It might sound a little bit boring, but during med school, you get lots of experience and lots of other things. Also, when you guys are in like fourth year and fifth year, and even third year as well, when you guys clinicals, you guys will have to travel a lot. When in final year, what people always say, you're pretty much living out of a bag, because every 2 weeks you need to switch to a different hospital. So you'll be around Jamaica the whole year, right? And there's hospitals in Kingston, Spanish Town, Mandeville, St. Elizabeth, Mobay, St. Anne. Yeah, I probably missed some, but pretty much you will be living around the whole island, right? And it's kind of a good experience, fun experience. some people kind of take it too much fun and they turn it into a party. So like I know sometimes like, you know, when you're going to like the party places like Mobay or St. Anne, like people get very excited and, you know, turn it more into the party than school. But just know that there's lots of social and clinical experience. So yeah, so that's one thing I never expected in med school that you guys should be prepared for, that you'll have to do a lot, right? So also next thing, uncomfortable situations are daily, right? So yeah, so you'll have to have a lot of mental fortitude with a lot of situations you'll be put into med school, right? From as simple as dealing with consultants to as, okay, so I mentioned Grey's Anatomy where like, you know, don't expect you're saving lives. One of the things that they do show pretty well in these shows is your interactions with senior doctors or consultants. It can get very, very, very nasty at times, right? And you know, people say things to you, right? They get, yeah, right? And it's gonna be very uncomfortable. You know, I've seen people break down crying, I've people seen people argue. Yeah, it's, yeah. And even when you're doing with patients as well, you're gonna be in very, very uncomfortable situations with patients as well, right? And it's, that's one of the things that with medicine is different with other careers. Like it's a very, like I said, it's art, it's a social career, it's a social career, right? You have to deal with these situations and you have to be able to smile and get through it. And you can't really like show your emotions, you can't retaliate, you just have to, it gives you a lot of mental maturity that you have to get through in med school, right? And that even starts in first year as well, because in first year and second year, you also have to start going off on these visits and doing these things where you have to have a lot of mental fortitude, right? So next thing is group work, right? So group work, I know for most of you guys is a bane of your existence. It's a bane of everyone's existence, right? It's quite annoying, right? And it can be great, it can be bad, right? Every now and then you get lucky and you get a really good group that you can work with, but most of the times you don't get to choose a group you work with. And group work, although they don't really emphasize this, is kind of like the foundation of how medicine works, right? So that's why they kind of emphasize group work from in med school, from first year, second year going up, right? Because even when you start working as a doctor, right, in the hospital, everything is pretty much group work, right? You work with other doctors, you work with other specialists, you work with other nurses, physiotherapists, other professionals, you have to work with lawyers, you have to work with the porters. It's legit, everything is group work going forward. You can never do this alone, right? And it's one of the things you have to get really accustomed with, right? You have to work well in a group. And I can guarantee you, like once you work well in a group, that's actually one of the things that really makes you shine as a doctor going forward, right? And people actually see that well, right? Because at the end of the day, you need to work in a group in the future. And if you don't work well in a group, that it's gonna be a problem, right? And it's, yeah, you're never gonna get rid of it, right? It's good to find groups of people that you can work well with, but like I said, sometimes you won't get to choose who you work with, right? Next thing is presentations, right? So that's another thing that's very different from medicine, from other science degrees, that in med school, you have to talk a lot, right? And it's a good reason they're making you talk a lot in first year and second year. I think in first year, I forgot the name of it, I think it's POLs or something like that, but pretty much every course, there's some form of presentation that you have to do, right? And it's not in front of like one or two people, it's in front of the whole class, right? And it's in front of a whole bag of old doctors as well, right? And this is going to continue for your rest of your medical school as well as your career. Right? Like even on the hospital, you have to present on ward rounds, you have to present to conferences, right? Many times you actually have students presenting at conferences. Even as consultants, you need to present, right? And get very used to talking. I know a lot of people don't even like talking. No one really likes talking and presenting, but you have to get used to it, right? And being able to present well gets you out of a lot of situations, right? I can like, even when, well, you guys can even talk to Brandon or other seniors as well, but even when you reach clinicals or further on, if you're presenting well, people don't bother you, right? If you sound confident and you can speak well, right? And you're not like hiding and shy, people tend to bother you, right? They normally pick on the people who look a little bit more scared and sketchy, right? So presentations is a very big part of it. So get it out of your system now that you'll have to present, you'll have to talk, you have to get used to it, right? You cannot hide from it in med school, right? Next thing, so your friends and family will never understand. So this is kind of related to the whole med school isn't like other degrees, right? So even though you may explain it to your parents, sisters, boyfriend, girlfriend, they will never understand what it's like unless you're in it, right? And that's why they always say like, you know, relationships outside of med school don't work, or like, you know, it's very difficult, right? Like for example, in fourth year and fifth year where you don't get any breaks, right? Like, you know, your friends, oh, let's plan a trip, right? And you're like, we don't, in med school, you don't really plan trips like that, right? It's a little bit more complicated, right? And then like your parents, oh, so don't you get like a time off? And you know, like, yeah, you get like a day off or a weekend off, but you don't really get like a 3 week off where you can go to Greece or whatever like that, right? And then also like even some situations where it's like, you know, having to like go to in a hospital, work all night, doing these duties, like, yeah, people don't fully understand what it's like, right? And that's why it's good, you know, you'll find friends in med school that you'll be able to relate to, right? Hopefully your friends outside of med school will be able to understand more, right? But they're going to be used to you disappointing them in a way, because you know you won't be able to be there. So like, even for you guys who have friends who went abroad to school, right? I know what always happens in med school is like during summer, all these friends come back and want to visit you, or all these family come back and want to visit, and you're like, well, I'm in school, and they're like, oh wait, I thought it's summer. Like, you don't get summers. I know we don't get summer, right? Or like, yeah. So it's one of the things that you have to explain yourself over and over and over to them, and they'll still never understand, right? And just be prepared for that. So moving on. Okay. So meltdowns and disappointments, right? So this can't be expressed anymore. Everyone in med school is going to have a meltdown and disappointment. No matter how good you are, no matter how smart you are, no matter how good your grades are, no matter what, you're going to have a meltdown and disappointment, right? Some people have more than others. Some people melt down once a rotation. Some people melt down 3 times a day, right? But it's going to happen, right? And there's going to be disappointments. Even with my grades, like people always say, oh, well, you probably always have excellent grades. I can guarantee you that no, some rotations were a little bit, yeah, a little bit bad, right? And, you know, even then, like you think, okay, you studied so well, you did so much preparation, and it's, you know, it doesn't work out, right? And it's just the best thing in med school is that you have to know that when these meltdowns and disappointments happen, you have to get up and move on from it, right? Even failing rotations, like people think failing rotations is the end of the world. Um, like, not to scare you guys too much, but majority of you may fail something in med school. It's a common thing that happens in med school. Don't see it as a, you know, a shame, right? Everyone fails. It's a thing that always like happens, right? Failing one rotation isn't a big issue, right? You have like nearly 100 rotations, right? And it doesn't really affect you much, right? You don't want to fail though, and still some people don't fail, right? You don't want to fail, but just know that even when that happens, it's not gonna like ruin your whole career, right? I had one friend, she was in the year below me. First year of med school, she failed 2 things, and she called me crying, like freaking out. Oh, she can't do med school. No, this is not made for her. She can't do that. And after those first 2 times she failed something in first year, first semester, she never failed anything again, right? And that's actually, you know, that was amazing, because really, for, you know, later on is when it's gonna even get more harder, right? So even these little disappointments you have, don't like just shake it off. I know for some of you guys, what happens to a lot of people in med school is that you're coming from high school where most of you guys are probably like the smartest people in your high school, right? And you're used to like straight A's all the time, doing all these amazing things, right? And now you come to med school and like you see your first ever B and you're like, what is this? Right? So just know that, just get used to that, right? Yeah, it's gonna be, you're gonna have disappointments, and that will kind of affects a lot of people that they're not used to, you know, not being the top or not having such good grades, right? And it kind of shakes them up, right? So just be prepared for it, and when it happens, just move on from it, right? And last thing, great memories and great friends. It's kind of like what I've mentioned already before, right? You're gonna have lots of great memories, right? Like I said, one of my greatest memories in med school was, yeah, we got to go on a cruise ship, right? And walk on a cruise ship and act like tourists all day. It was fun, right? You also got to go to the Kingston dump, which was fun, right? Even some patients, like all my patients in med school, I still remember, right? There are some amazing patients I had that, you know, were, you know, I'll never forget. Friends as well, since, you know, your other friends may not fully understand it, like you'll meet some people in med school which will be like lifelong friendships, because when you're stuck in the, you know, abyss together, you're gonna make some good bonds with people, right? Yeah, and yeah, the closest friends I have right now are the people I met in med school, right? So there's some good aspects of it, right? And even then, like I always say that even as doctors now, we all say we miss med school, right? Med school, like, although it feels hard now, when you start working, you're gonna realize med school is great, right? It was fun, right? There's lots of experience you can have from it. There's lots of, yeah, so you're gonna have some great memories. It's not all gonna be just work, 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 crying, crying, crying. You're gonna have some good memories as well with it. So moving on, what should be your priorities in med school, right? So firstly, is focus on grasping concepts, right? I use the quote here: give a man a fish and you feed him for a day, teach a man how to fish and you feed him for a lifetime, right? So you are learning to be a doctor for the rest of your life. You're not learning to be a doctor to pass your exam. Remember that, right? So focus more on understanding concept, not necessarily memorizing them, right? There's not like high school where you had to like memorize random things, like random dates and it's inconsequential information that's not gonna you're not gonna use in the future. Nearly everything in med school you're going to use in the future, right? The concepts that you learn in first year and second year will carry over for the rest of your medical career, right? And once you understand the concept, you will never forget it really, right? You may have to refresh it, but you'll never forget if you grasp it properly, right? Trying to memorize things, you'll forget it eventually, right? Trying to cram things, you'll forget it eventually. So just remember, understand concepts because they'll carry over for the rest of med school. For me, like I remember, I the first year of med school was FTT, Foundations of Disease and Therapy. I slacked off in that one. I didn't focus on it at all, right? And up to this day, I'm still, weak in that area. I still don't even know the difference between a cyst and an abscess more time, right? Because some of those things, like I just didn't focus on, and it would have made a big difference for the rest of my career if I, focus on those concepts from early, right? So remember, focus on concepts, and it's going to carry on for the rest of time, right? Don't really focus on, like the details, but really understand the concepts important. And that goes into the second point is never aim for shortcuts, which is kind of self-explanatory, right? Try, especially in these early years, try your best to understand what you're doing, right? That's the most important thing with pre-clinical, to understand what you're doing and understanding the logic behind the stuff. Next thing is learning for living and reading for your degree. So right now in med school, your priority is learning, right? Kind of goes back to the same point I mentioned earlier. You're not here to save lives in med school. You're here to learn how to save lives, right? Focus on that, right? Don't try to focus, okay, I want to go, and do this. I want to go and do a surgery. Because like you'll have opportunities where you get to do some cool stuff like that. But remember, your purpose right now is learning and understanding, right? So don't get sidetracked with other things that people do. Like I know some people stay all night at the hospital trying to do procedures or, yeah. Right now your emphasis is learning, right? When you're not doing anything at school, you should be reading, right? Yeah. So don't be going off and doing, trying to scrub into surgeries and no. Right now is for learning, right? Next thing is survival is necessary, right? And success will come, right? So right now, you're going to have, especially further in med school, you're going to reach into some dark places where you don't know if you'll be able to pass the exam, like the rotation, like you have 3 more days left in the rotation, right? And although I said never aim for shortcuts, I'm not saying you should aim for shortcuts, but remember, to be a doctor, you need to pass med school first, right? So remember, survival is necessary. That's an aim. Get through, okay? Get through, right? Do what all you need to take to get through, right? Same, although I was talking about having a social life and all those stuff before, right? Just remember that at the end of the day, you need to get through, right? And don't worry about right now, oh, guys, you want to, get these lovely grades, A's and all that stuff, right? Those will eventually come, but at the end of the day, the most important thing is survival and getting through it, right? Yeah, and the next thing is enjoy and learn from every bit of it. The good, bad, and ugly is kind of what we've been talking about already, right? There's be good times, bad times, and every moment you can learn from. My So my favorite rotations in med school are actually the ones I did worst in, right? Because those are the rotations I learned from it, right? Because, I learned from my mistakes and knew what to do better. When I get a good grade, you don't really get to, you don't really get to know what you could have done better, right? But when you do something bad, like especially if you fail, like I know a lot of people, they fail the rotation in med school, and when they had to repeat it, now they're like geniuses in that rotation because they had to do it twice, right? So like any moment in med school, you can learn from it, right? So just try enjoy it and learn from it. Even when a consultant cuts you off or like, a bad presentation and learn from it and just get better from it, right? So that's the main thing. You need to learn and get better from it in every experience, right? So, so everyone's good so far. We're soon wrapping up, right? Everyone's okay?
Yeah, we're fine. Thank you.
Okay, all right. So next thing is how to approach first year and preclinical years, right? So a lot of the things in preclin and clinical year are kind of related, but there's things that, a bit different, right? So the first thing that I think is the most important thing is to get organized and make a plan, right? One of the good things about preclin is that you have a schedule. You go to school 8 to 12 every day. That's it, right? You don't work, you don't have to go do nothing on the weekend. There's no random things. It's a great time that you can actually be organized. You have a life that you can schedule stuff, right? One of the reasons, like I said, how I went to bed at 11 o'clock every night is because I had a set schedule, right? As soon as, I started work by 1 o'clock, did X amount of hours of studying, took a break, went and did more studying, right? It's very easy to organize your life in pre-clin, right? So take advantage of it. I can guarantee when you guys reach clinical years, you will not be able to organize it, right? You might say, okay, I'm going to just go to school from 8 to 12, right? And all of a sudden you're there for a whole day, right? And yeah, or like a ward rounds, I've been, the longest ward rounds I've ever been on was 9 hours long, right? So, my day was just screwed when I finished that, right? So yeah, in pre-clin, you can organize and you can schedule your day, so take advantage of it, right? And make a plan as well. So the next point was keep up, right? So how the schedule is made is in a way that you actually, all the classes you do are pretty much your it's pretty much your syllabus, right? So go through the schedule from early, go through it up until all 13 weeks, I think it is, and kind of organize your studying and what to do, right? In pre-clin, if you guys want after, I can talk about my plan, but I don't like share what my plan was, but I had a very strict plan of how I studied, right? And because once you have a strict plan, you kind of can go into autopilot and just study, right? You don't have to worry, okay, what do I do now? You never want to be in a situation, okay, what do I study next, right? You want to have already known what you study next, what you're doing. I can tell in pre-clin, I could tell people in 3 weeks time what I'm gonna be studying, right? Like have a plan and organize, right? And that goes with everything, not even studying, but your research as well. Like, have a agenda. In first year of med school, first semester was actually my worst year of worst semester. And the reason is because I came in clueless. Like I had no clue. Like on the first few weeks, you're in college, you're gallivanting, you're just running around with your head chopped off, right? And don't do that, right? Like I said, it was my worst semester because I didn't know what I was doing, right? I just, like I said, I didn't study FTT. I spent all my time studying anatomy, like, yeah. So, and after that semester, when I learned from it and I made a plan, after that, everything went well, right? So the most important thing is to have a plan, right? And it's good to spend time and organize a plan. Like even furthermore, like later rotations in fourth year, 5 year, like what I used to do is like the first few days of rotation, I'm not even aiming to study. What I'm doing is planning on how I'm going to do this, right? Yeah, and talking about keeping up as well, you don't want to reach the week before exam and you haven't studied some topics as yet, right? There's a reason there's a schedule and a syllabus for a reason. Don't fall behind, right? Right, just most important thing, never fall behind, right? Because it's gonna be harder and harder as you go through med school to try to catch up with things. Like I said, the story with FTT, I kept on saying, okay, yeah, I screwed up FTT this semester, I'll catch up next semester, I'll catch up next year. Up to this now, it's been 8 years and I still haven't gotten a catch up with FTT, right? And I probably never ever catch up with it, right? So yeah, just make sure you keep up, right? That's keep up with what you're doing, keep up with your plan, keep up with the schedule, right? Next thing, discover what works best for you, and that's with school, studying, etc., right? So same thing was I was talking, right? Everyone is very different, right? Everyone studies very different. Everyone does different things, right? And you kind of have to know what works best for you, right? So like especially in pre-clin and now, like studying in high school and studying in college is two different situations, right? So it's going to take you a little bit of adjustment trying to know how to work with it, right? So once you understand what works best for you, it'll be great, right? You'll make things much simpler, right? Like for example, I found out like I can't study from videos. I know people love videos, I can't. So I can only study from textbooks. Unlike other people, they can only study from videos, right? So don't force yourself to do things that you're not just comfortable with, right? Find what works best for you, right? And stick to that, right? Even with studying, like I know some people, a common question people always ask me is like, which classes do you go to? Do I need to go to all classes? I know they don't like to advertise this in med school, but you do not, especially in pre-clin, you do not need to go to all the classes, right? I personally went to all my classes because I love going to classes, right? It works for me, but I know some people it doesn't work for them, right? So, I know some people, like, it could be funny now because, like, well, when you guys go back to being face to face, you'll see some people for the first time on exam day, right? Because some people just don't go to class at all. It doesn't work for them, right? So just know what works best for you, right? All right, so study tips, right? And don't worry, all of these stuff are going to start repeating. You guys might work out. So there's no right way. Find what works for you. We've already spoke about that, right? Yeah, like for example, for me, I can only study in complete darkness. I can't use hard copy books. Like some people need like a real hard copy book. I can only use soft copy things on a tablet, right? I can only study in complete darkness. I need earplugs in. I can't study, like I can only study at home as well. I can't study in random environments. Some people need to move different environments. Some people, like every week they need to go to a different environment to study in, right? There's no right way, just find what works for you, right? Next thing is make a plan and organize your resources as early as possible. You guys have probably worked it out from the things I've been saying already, right? But that's the most important thing, that you guys make a plan and organize from early, right? So like Brandon mentioned, that I've been working with Brandon for like from third year now, right? And one of the things I did is that I actually made a resource document where I pretty much organized all the resources for people and gave them tips as well, right? And I'm not saying people have to do it, but it'll make it easier for other people coming after you. And a lot of people have done the same thing as well. Other people are passing on their resources as well, but it's good to have them very organized and know what's there, right? I remember for, I think first semester, you guys have you do some self-bio courses, right? And then I think you do the exam in second semester. I never knew that, right? So I remember up to like 2 weeks before the exam, I was studying cell bio thinking I was doing an exam. And then one of my friends were like, oh no, we don't have an exam until next semester, right? So yeah, you don't have those moments. And yeah, those moments are going to happen, right? Or like, for example, I remember like in fourth year, I think yeah, it was fourth year, I couldn't find, like, I just never liked any of the textbooks. And the weekend before the exam, someone sent me this textbook, like, wow, this is amazing. Like, it works so well for me, but it's too late at that point, right? So just organize from early, because you don't want to reach exam time when you find something new that works for you, right? So organize from early as possible. I'll talk with Brandon after. If you guys want, I can try to send you guys my resources, right? Brandon uses my resources, and most people in clinical years use my resources, right? They're pretty well organized. They're not really too, helpful in first year and second year, but if you guys want, you guys can discuss with Brandon. I can share them with you, right? Next thing is aim for completion and divide your time equally. Yeah, so like I said, look at your schedule, know what your topics are, right? Look at all your courses as well. Don't focus on one course over another. With anatomy, I know that's could be like a time like people could use up most of their time in anatomy, right? And it doesn't make sense to do that. I think anatomy is like only 2 or 3 credits, while FTT is like 6 credits, right? And the credits give you an idea of how much time you should be putting towards it, right? So divide your time appropriately, right? Make sure you cover everything, right? Don't say, okay, I'm gonna only focus on important topics. No, you need to cover everything, right? And yeah, you need to cover all of them. And there's not gonna be a different rotation where you could catch up with something you missed in the first rotation, right? So aim for completion and divide your time equally. And the only way you can do that, like I said, is organize, right? Next thing is repetition is necessary, right? I can guarantee, so there are certain books in med school, I've read them at least 10 times already, right? You can ask Brandon as well. Some things that he learned in first year, he has to read again in final year, right? You'll have to repeat these things over and over and over and over. So don't beat up yourself, okay, I'm gonna read it once, I'm gonna memorize it and know it, right? It doesn't always work like that. You'll have to repeat some stuff, right? Personally, what worked best for me, I know like there's very rare situations. I know some super genius people have like a photographic memory and they can read something once and remember it, right? That don't work for me, right? What I did, like I realized I can only I had to read each thing 3 times, right? And that's the only way that could work for me, right? And while other people spend like a whole week studying one topic and they'll memorize it and don't have to worry, like to me, I realized I work with repetition better, and everyone at the end they kind of needs repetition. Next thing is use the timetable as a guide or syllabus. I already kind of explain how you do that, right? And when you guys reach clinical years, there's no syllabus, right? You really don't know what's coming in the exam, right? There's no topic list, right? It's really crazy. In pre-clin, you guys are lucky. They give you a syllabus, right? And I can guarantee like majority of the exam is on those stuff that are, if not even, yeah, pretty much all the exam is based on those classes you have. I'm not necessarily saying based on the things that people teach you, but the topics that the classes are supposed to teach you are what is going to come in exam, right? More study tips. So study group or study or no study group. So these are very, very big issue in med school because lots of people have different opinions of it and lots of people work differently, right? Hold on a second. Yeah. Okay, sorry, hold on a second. Yeah. Sorry. Yeah, so know what works best for you. I know some people say you need to have a study group in med school. That is a myth. It's not true. You do not need to have a study group in med school, right? Most people are gonna admit that most people have a study group and it does help some people, and some people swear by their study group. Some people say they couldn't get through med school without a study group, right? Especially in MBB as well. You guys are first year, so it's far from that. But even though everyone says in final year you need a study group or you need that to succeed, right? I personally, I never had a study group the whole 5 years. I personally cannot study with other people, right? I just can't do that, right? But keep in mind, if you know that you need a study group and it works best for you, study with them, right? Find a study group that works for you, right? And don't just think that every study group works. Like, find a group of people that work well for you, right? So don't be too pressured. Oh, I don't have a study group, I'm gonna fail, right? Don't worry about that, right? And luckily you guys have Brandon, right? Luckily you have other resources. You have people who are gonna help you. One of the things that's very helpful with study groups is that they kind of help you, like, keep a, like I said, that story with the cell bio where a friend told me that the exam wasn't happening. Like, if I never had friends like that, I would have never heard that, right? Study groups share resources, they give you like tips, you know, they help you out, right? So it's good to sometimes have people there, but you don't necessarily need someone that you need to read the book with, right? But it's good to have people there, right? Next thing is be flexible. Same thing, I was saying, you kind of need to work with, like, you kind of need to find out what works best for you. But also in certain situations, it's kind of hard, right? When you guys move on to clinicals, like I said, sometimes you'll be at the hospital from 7, well, even sometimes I know some consultants start their ward rounds at 5 a.m. in the morning, right? So you'll need to be at the hospital from 5 a.m. in the morning. You won't leave until 2 o'clock in the midnight, 2 a.m., right? It's gonna be really crazy, right? Yeah, you'll have to be very, very flexible with how you're studying and working. Right now in pre-clin, you guys are blessed that, you know, it's very scheduled and it's very organized, but it's not gonna be like this for the rest of medicine, right? Especially when you guys actually become doctors as well. Like, how you guys, how, well, I never knew this when I was at your level, but even when you're studying as like doing residency, like you're gonna be working at the same time that you're studying. Like, you're expected to go in and see patients every day and also study, right? So you'll have to be very flexible, right? And the best doctors are the ones that are dynamic and can work with the situation. And next thing is ask for help or advice from reputable sources and multiple sources, right? So I already mentioned why you should always ask for help and advice, right? Don't be afraid, right? Don't be afraid to ask for help, right? It's nothing bad to ask for help. I always had people I asked for help from, right? I found people I always asked for help from. And now what I mentioned here is reputable sources and multiple sources, right? So everyone is going to say what they should do, right? Don't listen to everyone, right? Reputable sources, people, you know, who are doing well, understand, and also sources that are work similar to you. So I know some people who work similar to me or understand like how I work, right? So I always ask advice from them because they kind of, you know, we work similar, right? It doesn't make sense to ask help from someone who works totally different from me because their advice won't help me, right? And also from multiple sources. Although you guys are listening to me or you guys listen to Brandon, always listen to multiple sources, right? Everyone can, you know, there's be something that you probably never heard of that, you know, that you need to hear from, right? So always get multiple sources, right? But just know that at the end of the day, don't overwhelm yourself and you don't have to listen to what everyone says, but it always doesn't hurt to listen to multiple people, right? So yeah, finishing up now. So USMLE, right? Don't worry, I'm not gonna talk much more about this because I haven't even done USMLE, to be honest. So I'm not a professional at USMLE, and yeah, but we'll still talk about it for a little bit, short, right? So what is it? It's the US medical license exam, right? So to practice and study and also, to practice and study and also to specialize in America, everyone needs to do the USMLE from all countries, even Americans need to do it as well, right? Right? That pretty much means that you're a licensed doctor to work in America, right? And before you specialize in America, you need to do it, right? And what does it entail? So it entails 4 exams, right? Step 1, step 2, which is divided into step 2 CS and step 2 CK, right? And there's step 3, right? So step 1 is pretty much all of pre-clin knowledge. So all the stuff in first year, second year, and a piece of third year is what's in step 1, right? Step 2 CS, which stands for clinical skills, and step 2 CK is clinical knowledge, right? Those are the stuff that you can learn in 4th year and final year, right? Those are the clinical patient related stuff, right? And step 2 CS is actually where you actually have a patient and have to examine a patient. So that's more clinical stuff, right? And step 3 is not necessarily, you don't have to do it before you specialize, but that has to do with more postgraduate stuff, like working as a doctor, right? So you have to worry about that as yet, right? A common question is, when is it best to do it, right? So ideally, I wish I did this, but I know it would have been very hard, right? And don't pressure yourself if you can't do it. The best time to do step 1 is after 3rd year of med school. The reason is because step 1 has to do with preclinical knowledge, right? So it's best that you do it right. You do step 1 right after you do all your pre-clin stuff, right? The longer you wait to do step 1, you pretty much have to restudy those things fresh, right? So like, yeah, so if you do it after 3rd year, all the pre-clin knowledge is fresh, right? But remember the tip I said, survival is necessary, right? Yeah, I know some friends are focusing on the step one and they're failing rotations, right? And you cannot be a doctor in America if you haven't passed in Jamaica first, right? And remember, you also have to gain the knowledge here first. Focus on grasping the knowledge and understanding, right? So if you know it can't work for you, I know personally, I started in third year and I said, yep, this can't work for me, right? So I gave up on it. I know some people it could work for them, they did well, right? So you just need to know, what's best for you. But ideally, the best time to do step one is after third year. And then step two CS and step 2K, you can do it after you finish med school in Jamaica, because that's when you need the clinical knowledge to do it, right? But that being said, you can do it whenever you want. You don't even need to do it in order. You can do it in any order you want as well. You can do steps 2 CS first, then step 1. It doesn't matter the order. Another thing I need to say about is do your research and career planning first, right? Look at other options, right? America is not the only place to specialize, right? Many other places you can specialize, right? There is nothing wrong with specializing in Jamaica, right? There's nothing wrong with specializing anywhere, right? You just need to know what works best for you, right? So don't feel pressured, okay, you need to do USMLE, right? You just need to find out what works best for you and look at your options and also understand what it is first before you commit to it, right? Because I think step one, I think is 1,000 US to do the exam, right? Don't do all the steps and realize, I actually don't like America, right? That's just a waste of time, resources, and money, right? So look at your options and decide what's best for you before you just commit to something, right? So now the profession door is a final thing now, right? Do what you love and love what you do, right? Med school is much easier if you love what you're doing, right? It doesn't feel that problematic to you. The people I know, I had a close friend. She never wanted to do medicine. From the first day she hated medicine, she was forced to do it, right? And it was painful the whole 5 years, right? I know even some of you guys now you love it, and even some moments in the future you're gonna feel, yep, I don't love this anymore, I hate this, right? But just remember, it's easy is always best to, if you love it, it'll be much easier, right? Next one is number one rule of medicine. So I know when most people hear of medicine, you think, you're supposed to save lives. No, the number one rule of medicine is do no harm, right? That means you need to not hurt people, right? You need to know when to act and know when not to act, right? Know your limitations, right? If you save one life, people, that's good. If you kill someone, people never forget that. If you hurt someone, people never forget that. That's how you lose your license, right? That's how you lose your reputation, right? Harming people is much, 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 much worse, right? Even when you become a doctor as an intern and furthermore, when in doubt, the best thing to do is nothing, all right? Because if you do anything that hurts people or harms them, that's when it's bad. As a doctor, you're supposed to know better, right? And that means if you're a doctor and you hurt someone, that's bad. Anyone else can hurt someone, right? All women can hurt people. Anyone else can do that, but you can't, right? So do no harm, right? And know your limitations, right? It doesn't matter how smart you are or whatever, right? If I was driving on the road and I see a car crash and, I see someone spleen out, right? I can't do that, right? There's no way I can do that. I can't help that situation, right? And I'm going to go to bed sleeping well that night knowing that, yeah, I couldn't have done it, move on, right? Same thing in the future, like, you're going to get in these tough situations where, yeah, you think, okay, this is above me and that's okay. Everyone has a limit, right? So just know your limitations. Another day, do no harm, don't hurt people, right? That's the main thing you should focus on, right? Be a safe doctor, right? Next thing, the delivery of good medical care is to do as much as of nothing as possible, right? And it means no doctor wants patients, right? When you start working, you understand what this means, right? But always try to prevent people from getting sick than fixing a complication, right? When you start seeing patients, you ideally do not want the patient to come back to you. You want them to be healthy for the rest of life and they don't have to come back, right? So the best thing you want to aim that you don't have to do much, right? Because the worst case scenario is bad, right? For example, simple things like with cancer, right? You'd rather that you teach a patient on how to prevent cancer than you want to treat cancer, right? Right? So always remember that you aim to want to do nothing, right? You aim to want to be in a situation where you don't have to help someone, right? Or you don't have to do these fancy surgeries or do these crazy things, right? I think this is the last slide now. So a good physician treats a disease. The great physician treats a patient who has a disease, right? Remember, medicine is an art, right? That being said, that means that there's lots of things that the books will never teach you about treating a patient, right? A lot of your classes that you guys will have IMP, you have ethics, you have a whole heap of courses that are kind of teaching you how to be a human, right? They're teaching you how to have empathy, they're teaching you how to relate to people. That's one of the reasons why you get so much social experience and group work, because there's a lot of things that yeah, it's not the disease process you need to treat. You need to treat other situations, right? I've had patients like, especially when you guys start working, especially in the clinic and rural settings, patients are going to come to you with things that are not medical related. They're going to come to you about domestic issues. They're going to come to you about their child issues. They're going to come to you about other issues. They're going to come to you saying, "Oh, well, doc, I'm depressed," right? And yeah, that's still a medical issue, but you remember you need to treat the whole patient, and that's what's important, right? And it'll make a world of difference. If a patient respects you and you relate to them well, they'll actually get better, right? Yeah. And what does and the next thing is, what does the DR in front of your name mean? What do others see you as? And reminder, there's always eyes on you, right? Being called a doctor is a big, big privilege, right? And it's also a great responsibility, right? Once you're a doctor, everyone sees you as a doctor, right? I can guarantee you, right? Once you walk anywhere and you say you're a doctor, things change immediately, right? And there's always going to be people watching you. People expect doctors to be pretty much responsible, ethical people, right? They're supposed to be, there's a reason that they always need a doctor's note, or you need like a doctor to sign off on stuff, right? Especially in the future, one of the things that doctors do a lot is like signing off on documents, right? Because they pretty much know that doctors have said an oath that we're ethically responsible. We always look out for people. We're not going to hurt anyone, right? And that's a lot of responsibility, right? And there's going to be eyes on you all the time, right? Doctors can't get caught doing bad things, right? A lot of times that you hear now, like people always have a bad idea of doctors. Oh, this doctor is so bad, they're criminal, they're crooks, right? And that's because one doctor ruined it for everyone, right? There's always gonna be watching you, and once people watching you see you do the wrong thing, as a doctor, it looks much worse, right? So just remember that when you become, even as students now, always work on it now, that when you're in public, always act accordingly, right? There's people who be watching you, and you can't do things that are against society. You can't be doing these bad things, right? It's always easier personally what I do. I don't tell people I'm a doctor when I'm in public, right? Because once you tell, right, it's a totally different scenario how people treat you, right? There's a little bit illegal, but it's facts, right? If every time I get stopped by a police, once I say a doctor, they say, yeah, go ahead, right? And that's truth, right? Once you go into certain environments, right, like, and you say doctor, they're going to treat you different because you're supposed to be different from other people, right? So just remember that, right? There's a lot of pressure and it's responsibility, and just remember that for the rest of your life, you're going to have that responsibility on your shoulder. The last thing I want to leave you on is you are in charge of your own narrative, and it's your life to live, right? Although I just spoke about being a doctor and its responsibility and it's still your life to live, right? Do what you love, right? Do what's important to you. And you choose your life, right? All the people in med school, you'll hear lots of people doing X, Y, and Z outside of med school, people starting businesses, people doing lots of random stuff in med school, right? It's your life to live, right? You need to know what's best for you, right? Lots of doctors, as soon as they graduate, they never practice again. And that's a fact of it, right? Some people, I've known doctors, they're big consultants and they decide they're going to go back to school and learn something else, right? So just know that although you're here and you're a doctor, you're in med school now, things might change and you may need to change how your life is. You might need to make different decisions, right? And just remember, it's your life to live, right? And you're in charge of it, right? So don't feel too strapped that, okay, I'm stuck, right? Yeah, it's still your life, right? So that's why it's important to have a social life, enjoy your passions, know what's important to you, right? It's still your life, right? So that's pretty much it